It's another interesting time on your number one health program, Health Watch, reaching you from Nta Lagos, Channel 10, the station for excellence. Today, our focus is on a topic that affects everyone, and when I say everyone, both adults, children, and youth. And most of the time, it affects the way you think, your behavior, your mood. You know, it's a part of health that everybody needs. You know, nobody's above it. All right. So today our focus is on mental health. And when we talk about mental health, a lot of people mistake mental health for someone who is mad. No. Today on the program, we have a professional who will be telling us the difference between mental health concerns and mental health illness in the person of Dr. Bello Mojid Mashuda. She's a psychiatrist with the Federal Neuropsychiatric Hospital here in Lagos. Plus, we have a report on quack doctors. And so how do you find out if the person attending to you is a quack medical professional? And you'll find out on this 6th edition of Health Watch. My name is Nkem Okibe. You know I love to do this with you every week. We'll go on a short break. When we return, we'll take the interview with Dr. Bello Mojid Mashudat. We'll be right back.
Mental illness is a medical condition that has to do with an aspect of the functioning of the brain, and it affects how people feel, how they think, how they behave, how they relate. So invariably, we're talking about medical condition that has to do with the brain that affects the behavior and other aspects of feelings, emotions, and thinking. And it's on a spectrum. We could have those that will just be mild, people are still functioning, but it's beginning to affect the relationship in a way. And we have some that are very severe, that it affects major functioning, and it impacts on overall well-being. People, and there's a need for people to understand the differences between mental health and mental illness. Mental health has to do with our emotional well-being, our psychological well-being, our social well-being. And everybody needs mental health. Just the way we talk about health in terms of physical health, mental health is a component of health. And this is why when we look at the World Health Organization definition of health, it says that it is a comprehensive and overall physical, mental, and social well-being, and not just the absence of disease or infirmity. So the aspect of the mental must be an integral part of health before we could say an individual has a good state of health. Now, mental illness. First, we said everybody needs mental health. At different points of an individual, the health could be affected. So when the aspect of the mental health is affected, we are referring to mental illness. It's a medical condition that manifests with alterations or deviations in the emotional well-being, physical well-being, how people think are affected, people emotions, people relationships, and we have a deviations from the behavior of the individual. Many a time when we talked about this mental illness, it impacts functioning, it impacts how an individual relates, and that is key when we talk about mental illness. Mental health issues, as a reminder, is no respecter of anybody. It can affect both male and females, irrespective of the gender. It can affect children, adolescents, teenagers, youth, adults, elderly. It cuts across ages. The common ones that we could see very slightly when we talked about the age group. For those that are children and adolescents, some of these mental health issues, remember we talked about it's a behavior, thinking, feeling, and all that. Some has to do with the development of children. And we talked about developmental issues. Some do not understand basic concepts. Some have some intellectual or thinking delay. Some are restless. They have attention and hyperactivity problems or challenges. But the bigger ones that we see as they're growing older have to do with aspects of anxiety, emotional problems, anxiety, depression, panic attack, unduly fearful. Some are so clingy, and it's getting to the point of affecting how they're able to function in the community. As they're getting to adolescents, the emotional problems are still key. In fact, emotional problems affect all age groups. When we're seeing adults, we may start to see those that may have, even adolescents, self-esteem issues, panic, depression, bipolar affective. Some are always on the edge, some are hyperactive, some the brain is just working so fast and the thought processes are so fast, they're not able to control it. In some, we have major distortions on how people think, or what they hear, or what they see. Some may start to hear people talk without seeing them. Some may be seeing unusual things not seen by others. And some, they have major sleep problems. In some other people, we have the aspect of the memory, especially in the elderly, dementia. So we have various mental health issues. When we talked about the distortion in thinking, psychosis, like schizophrenia, and some have eating problems. Some have problems with body image, and these are mental health issues. Some have problems with the personality, how they function, they are mental health issues. So they are wide across different age groups.
If you're just joining us, the program is still Health Watch. Our focus today is on mental health. And our guest is a psychiatrist with the Federal Neuropsychiatric Hospital here in Lagos. And she has talked about the difference between mental health illness and mental health concerns. And moving forward, she's going to be talking about the signs to look out for. What are signs that you see in a child, that you see in a teenager, that you see in an adult, that you see in your loved one, and you're like, this person needs to see a psychiatrist, and this person needs to see a professional, you know. And this is what this program is all about, keeping you abreast on awareness, on health issues awareness, all of that on this program. So let's go back to the interview. We'll be right back.
For the early warning signs for mental health issues, there are slight changes when we talked about the early warning signs in children, adolescents, and when we talked about it in adults. For children and adolescents, the early warning signs are majorly wrap-round bodily symptoms, vegetative symptoms, things that have to do with the sleep, appetite, how fatigued or how strong they are. So for children and adolescents, many times they may start to complain of tiredness, or they just don't feel like going out. They may want to stay indoors. They don't feel like going to school. Some of them may start to complain of bodily symptoms like stomach ache, headache that they can't describe, and they want to be clinging. Some are unduly irritable without obvious reasons. Major changes in appetite, they're not eating, and we are emphasizing on this because people may start to take them from one point of physical health condition to the other, and they're not improved, and these are early mental health warning signs that we may need to pay attention to, and they can't describe. For some children, they start to draw. They may start to draw a coffin and put themselves and label themselves there. Some may get up in the morning and they're just weepy, or they're talking or trivial things. They are saying that they've offended the whole world, and they start to beg for forgiveness. And before we know it, they may start to harm themselves. They may take sharp objects like needles and they start to cut, because they're not able to express or describe some of these unusual inner experiences related to mental health issues. So when we move to adult or adolescent or youth or adults, they are able to describe better. They may talk about feeling unduly unhappy. They feel that nobody likes them. They feel hopeless. They feel they are not doing well in school, or we may start to see poor academic performance or truancy. Some of them may just out of the blue start to use substance of abuse. And we may see it in youth that apparently they've been doing well. They started to use substance to cope because they don't understand some of those things that are ongoing. For those that are not adults and things like that, they may talk about there's no point living. They're trying to protect other people around them, and before other people harm them, they want to maybe end the life of people around them before they end their own life. They're having major suicidal issues. They're hearing voices. They are aggressive. They may be unpredictable. They are withdrawn and things like that. So we have, for when we are talking about the dementia, that's when we have major issues with orientations, with memory, with concentration. They are not able to locate the spaces in the familiar environment, and they may be aggressive, they may have psychosis, and many more. Help is available for mental health problems. And part of the help is to ensure that first, we prevent it to avoid real development. And anytime it has developed, there is treatment, management that are effective, that are helpful to control the symptoms and ensure that affected individuals enjoy optimal health. In terms of the prevention, we talked about raising awareness about mental health issues. We talked about destigmatizing the concept of mental health. Everybody needs to understand what mental health stands for. Everybody needs mental health. Just like we normalize hypertension, diabetes, and other physical illnesses, we should normalize mental health issues that has to do with deviations in behavior, in our emotions, in our feelings, in our thinking processes. So when we normalize, and we know it is because we have a deviation in the functioning of some aspects of the brain that controls our emotions and our behavior, and not due to a demonic affliction or because somebody somewhere or older generation had done something wrong and they are now atoning for the sins of the older generations. No, that's not mental illness. So when this is clear that it's a medical condition, we begin to accept people exhibiting or manifesting some of this behavior that are not the norm. From there, we make people feel loved and they can start to talk about it. They come out to say they have this feeling and that they need help. From there, when we have the full-blown development of mental issues, there has to be treatment. And treatments are multidimensional. We have the aspect of talking therapy, just the way we are doing this talk, this beautiful awareness talk that can never be overemphasized. Some may need to have some social network connected as part of the talk. Then we'll move to the other aspects of some behavioral changes as part of the treatment. There is another part of the treatment that may have to do with the use of medications when necessary, only when necessary. No professional will give medication if that is not what is required. So for the different level, we have those that are still at the minimal level when they develop mental health issues. We have psychologists, we have psychiatrists, we have behaviorists, we have people that are trained, that are expertise, that use different forms of talk therapy to resolve many of those concerns based on real underlying theories that work when they use it to manage the mental health issues. We have the other aspects of behavioral modifications, including modification of sleep, lifestyle changes, watching what time, duration of sleep, sleep for a minimum of 7 to 8 hours in a day, ensuring that when we feel sleepy, we go to bed, ensuring that we take healthy diet, we have healthy exercises that are relaxing, we connect. Then when we talked about the drug management, for some that may just need some part of medication, it may be in form of brain tonic that they are giving. It may be in form of some brain multivites that will help the brain to calm down. We have different brain building multivites that are targeted in ensuring that we have optimal outcome. For those that have major mental health issues, we may need to use some other medications that will improve dopamine level or serotonin. Remember, we talked that those chemicals are really mood elevating and make us feel very good. For some, we have some chemicals that will ensure that the electrical activities of the brain are also calmed down. Some will improve sleep, and some will improve concentration and the aspect of our sleep. Mental health can never be overemphasized. Everyone needs mental health. It's a glass that must not be broken. we should mind our mental health. It needs to be put at the forerunner by every one of us. Just the way we talk about physical health, we need to start normalizing mental health and mental health issues. According to World Health Organization, comprehensive health has to do with physical, mental, and social well-being, and not just the absence of disease or infirmity. So, mind your mental health. There is no health without mental health.
Wow, thank you so much, Dr. Bello Mojid Mashudat. She is a psychiatrist with the Federal Neuropsychiatric Hospital here in Lagos. She has done a whole lot of treatment to that topic. When I say treatment, she has been able to expose a lot of things. Now you know that when you hear mental health, you're not supposed to conclude and say the person is mad. No, it doesn't have anything to do with mental health, illness. They are two different things, and I'm sure you're able to learn the disparity between these two. Moving on, we have a feature on how to identify quacks in the medical profession. We'll be right back.
According to a popular saying, health is wealth. Health is the most valuable possession an individual can have. Staying healthy is priceless. When one is sick, being treated by a quack medical practitioner usually jeopardizes the treatment process and leaves the sick worse. Quacks in the medical profession is a decay in the system that has led to the loss of many lives.
Quacks can be defined as dishonest people. They are not doctors, they are not nurses, and they claim to be doctors and nurses, which does not supposed to be.
Quackery in Nigeria's healthcare system continues to rise at an alarming rate, especially considering the harsh economy that has affected all sectors of the nation. Medical experts have identified some reasons responsible for quackery in the profession to include uncultural beliefs, brain drain, expensive and ungoverned healthcare.
Quacks are able to deceive their patients because of desperation. When the patients are very desperate to get treatment, so they will be able to lure them to themselves. Poverty. Some people don't have money to go to hospital, so they tend to patronize quacks.
The constant need for adequate healthcare delivery in a country with over 223 million people and few number of medical practitioners, which results to a poor doctor-to-patient ratio. This makes people vulnerable to quacks in the health system. In some cases, patients have received injections from nurses that cause harm or even paralysis.
There was once a case of a child that was brought to our facility from another facility. She was in point of correction, he was having injection abscess. The quack refused to use aseptic techniques in giving the injection, and it became quite a big problem. There was a deep hole about 2 inches at the left lateral part of the buttock. Please note, a quack nurse will be the one lobbying for work, will be the one coming to your house, will be the one bringing out injections to give to you.
A quack is without credentials. They don't have certificates. They are not trained. They didn't go to nursing school or medical school. A quack will always refute what the doctor, the diagnosis and the treatment doctor have given to you. A quack always have medicine that cures all, wonder medicine, magical drugs. Now, for you to be able to dictate a quack hospital, for example, in Lagos here, the hospital must have a FEMA logo outside. Any hospital you see without a FEMA logo, is not accredited hospital.
The consequences of quackery in the healthcare are devastating. However, to contain the spread, there are measures advised by medical professionals.
To reduce the quacks, there should be strict regulation from the government. Like in Lagos State, they are doing very well. The health farmers are doing very well. They are monitoring units. They are doing a very good job. They go to hospitals. They check people's licenses. And government to put into law punishment to be given to quacks. To quack doctors and nurses, there must be a punishment that will be given to them.
A healthy population is one of a nation's most valuable assets. Therefore, it is pertinent that strict regulation, enforcement of healthcare standards, public awareness campaigns are to be adhered to, as all this will help rebuild trust, improve patient outcome, and provide high-quality care to the people.
And that's the much we can take on this week's edition of Health Watch. Remember, I normally say health-conscious people live longer. So you notice anyone around you behaving funny in terms of being irritated, being unnecessarily aggressive. You need to be able to speak up to the person. The person also needs to open up to his or her loved ones, your family, your friends, your colleagues. I think that's a huge way to get yourself out of this mental health stress that affects everyone. You have questions, you have comments, you'd like to sponsor this program, please send a text only to 07060865487 or send a mail to orkibenkem@gmail.com. My name is Nkem Orkibe. Join us next time, next week, same station, same time.